The director of the Center for Neglected Tropical Diseases Research at UHAS, Dr. Alfred Kwesimanye, says although mental health and NTD programs operate under the Ghana Health Service, they function largely in isolation. He explains that when patients report with skin-related NTDs, their physical condition is treated, but their mental health is often not assessed despite the heavy psychosocial burden associated with stigma and discrimination.
Our aim is to be able to pool the two programs, mental health department, mental health authority, and then the neglected tropical diseases program in Ghana Health Service together, so that we can have an integrated tool. And if a patient appears in any health facility in Ghana, we'll be able to assess the person's mental health status and also treat the person of the neglected tropical disease, because the neglected tropical diseases come with a lot of psychosocial things. They come with a lot of pain. They affect poor people with skin condition that comes with a lot of stigma. So because of the stigma, it creates a lot of psychosocial issues for even families, caregivers, and then the patient themselves that are affected. So if we are able to conduct this project successfully, which we are piloting in Ho Municipal, Hohwe Municipal, Elembele District, and Bole, which are endemic district for some of these skin NTDs, we'll be able to come up with an integrated tool that can be used in other parts of the country.
The director of the Institute of Health Research at UHAS, Professor Alexander Nsamenu, emphasized that research must directly impact lives. He noted that NTDs such as elephantiasis and leprosy are closely linked to poverty and stigma, which often worsen mental health outcomes.
Research should not be done just for the purpose of doing research, but it must impact lives. If we are doing research that do not impact the lives of Ghanaians and has policy relevance, then we are just wasting time and wasting money. And so this is one of the key research that we believe is going to touch lives. Neglected tropical diseases, especially those that have skin manifestation like elephantiasis, where you see people with very big legs, and then leprosy, have been neglected and are always associated with poverty. And we know that poverty is one thing that makes people lose opportunities in life. We do not have the same access to the things that other people have access to. But not only that, the poverty has made them susceptible to getting these diseases that we are talking about. And having got those diseases, then the next stage is that they are stigmatized. Stigmatization does not only come from people that they live around, sometimes in health facilities, and sometimes even between them, because your neglected tropical disease is worse than mine, or your socioeconomic circumstances are worse than mine, so I would stigmatize you. And stigma affect their mental health. Their mental health also affects their ability to access services, and it worsens it.
Head of the research unit at the Anesvat Foundation highlighted the importance of implementation research in strengthening person-centered care and improving quality of life for people affected by NTDs.
University of Health and Allied Science, as many other health and research institutions in Ghana and in Africa, has enough potential to do huge research interventions and a research project as this one. Implementation research is very important because it can lead to changes to people affected by neglected tropical diseases, and we do believe that strengthening this person-centered care, getting together the mental health and the entities for a more biomedical approach will will improve the quality of life of people affected for entities in Ghana.
The 4-year Imagine Ghana project aims to produce an integrated assessment tool that will allow health facilities across the country to treat both the physical and mental health needs of patients with neglected tropical diseases, ensuring holistic and dignified care. Ivy Setoji, Joy News. Who?